Good afternoon, and thank you for joining us here today as we talk about the COVID-19 pandemic here in Erie County. And I'd like to start today by providing an update on the grant applications for the COVID-19 Hospitality Industry Recovery Program, or CHIRP, that we announced last week. Applications opened just this past Monday, and 73 applications have already been submitted. Please don't wait to submit your application if you fall within that industry, because grants are going to be awarded on a rolling basis. There is a bit more than $3 million of funding available, and eligibility requirements are available at ecrda.net. That's the Erie County Redevelopment Authority's website. Now to our daily reports. 179 new cases were reported today. And I know that that is a much higher number than we've seen in a while and may sound a bit shocking, but let me explain. Last week, I alerted everyone that Albion State Correctional Institution would be conducting mass testing on Saturday on their inmates. So we anticipated that there would be a spike in cases, and today we are seeing those results. Out of the 179 cases reported today, 132 of those cases are from the Albion facility. Yesterday, 12 out of the 51 cases reported were Albion SCI cases. And we expect that there will be more coming in the next day or so, so you can expect to see a high number most likely again tomorrow. But remember that those individuals, of course, are not out in the community. They are in congregate living at the penitentiary, and so the risk is a bit lower to the community, although the corrections officers, of course, are the ones who have that contact with them. So that brings our total cumulative positive cases since March to 17,875. And we still have a total of 444 deaths reported in the NEDS system. The positivity rate for Erie County was 7.3% for February 26th to March 4th, according to the Pennsylvania Department of Health. As of this morning, there were 29 total COVID-19 hospitalizations, with 3 individuals on ventilators at Erie County hospitals. Until everyone in Erie County can become fully vaccinated, please continue to do all of the things we've asked you to do for so very many months. To wear a mask that covers your nose and your mouth when you go near anyone who doesn't live with you in your home. Keep a 6-foot distance from others. Stay home as much as possible, and definitely, if you feel ill at all, stay home. Make sure you monitor yourself and get a test if it potentially could be COVID-19. Dr. Howard Nadworny is with us today to provide some insights on the recent changes to the CDC guidelines, as well as some updated information regarding vaccine. So we'll now ask Dr. Nadworny to join us.
Thank you, County Executive. I wanted to make a couple of comments about the updated CDC guidance for those who have been fully vaccinated. First of all, those who are fully vaccinated are those people who are 2 weeks after their last dose of vaccine. So if you got the Pfizer or the Moderna vaccine, it's 2 weeks after the second dose. For those who will be getting the Johnson & Johnson vaccine, it will be 2 weeks after the single dose that you get. CDC has now recommended that if you've been vaccinated, you don't need to mask when you are in a gathering with other vaccinated people. And that's because the risk is greatly reduced because all of you have been vaccinated. They've also changed the guidance for family groups when you've been vaccinated, and they have added a caution that you should only gather if the risk to the people you're gathering with of having severe disease is low. The reason that the CDC has made these recommendation changes is because they're being very cautious. We don't yet know how effective this vaccine is at preventing vaccinated people from getting infection and spreading it yet. And we also don't yet know how effective it is in the real world because we've only been vaccinating really for the last 2.5 months. So the CDC is recommending somewhat more freedom for those people who've been vaccinated, but they want to be very careful because if it turns out that the vaccines are less effective, or it turns out that because there are so many cases still circulating that we are not identifying, which is likely true, that the vaccine may not be quite as protective for those people at risk of getting severe illness as we are hoping that it will be. So I think that they are trying to move slowly so they do not need to reverse their recommendations and say, oh, we were wrong, you really need to be much more careful. And I think that's why they have not made recommendation changes for flying on airplanes or people in congregate settings or people getting together in larger groups. We know just from the Erie County data that the odds of having someone with COVID, even in gatherings of only 25 people, is about 1 out of 6. So that if there are multiple groups getting together, even if some people have been vaccinated, there's a real risk that someone could have COVID and spread it. We are clearly not out of the woods when it comes to number of cases. In fact, our number of cases, although declining, is still significantly higher than it was from last March through the end of October. So there's still a lot of coronavirus in the community. I think that it is likely that as more people get immunized and the number of cases fall, that the recommendations will change to give vaccinated people more freedom to associate with more people and perhaps some relaxation of mask wearing in groups of people who are all vaccinated. But I think this will take time for the CDC to determine. Thank you.
Thank you, Dr. Nadworny. And next we're going to have Brianna Adams, who's going to share some information today on a COVID-19 prevention checklist for events. Brianna is the Director of Environmental Health Services at the Erie County Department of Health. Brianna?
Good afternoon. Thank you for the opportunity to share our event planning checklist for the spring and summer of 2021. Historically, Erie County Department of Health has issued licenses for temporary events that involve food, campgrounds, or body art in a non-permanent setting. This includes events like Celebrate Erie, the Albion Fair, the Wild Rib Cook-Off, the Cherry Festival, and Heritage Days, to name a few. To continue our COVID response efforts, we have developed a checklist for all events taking place in Erie County. They would submit the checklist prior to their event, and it includes events that we have not traditionally licensed, such as sporting tournaments, runs and walks, and parades and fundraisers. The goal of the checklist is that it will serve as a portion of the COVID prevention plan for the event. The checklist includes a maximum occupancy calculator for both indoor and outdoor events, and it asks how capacity will be limited, monitored, and enforced. Additional questions include information about masking, traveling vendors or participants, cleaning and sanitation, food and alcohol service, and entertainment. We ask that the checklist be returned to the health department at your earliest convenience, and if food or body art vendors will be present, or if people will be camping on site, the checklist can be returned with the license applications for those licenses. Once the checklist is returned, it'll be reviewed by members of our COVID response team. We have developed a rubric to evaluate the risk of the event by looking at the number of people, if food or alcohol is being served, and if there's entertainment on site. Our COVID response team will communicate with the event coordinator if there are items of concern. And while we cannot approve these plans because there is still an inherent risk with any event, We're working to make sure that they do meet the current targeted mitigation orders that have been set by the Governor's Office and the Pennsylvania Department of Health. As a reminder, the current capacity limits for events and gatherings are set at 15% of the maximum occupancy for indoor events and 20% of maximum occupancy for outdoor. If the indoor capacity is unavailable, please contact the building code officials to determine what that number is. As the weather continues to get nicer and as the sunshine today reminds us, outdoor events are being planned for the summer. So to determine the outdoor capacity, you first determine the square footage of your event space. Occupancy of 67 people per 1,000 square feet is considered maximum occupancy. That amount would then be reduced to 20%. If you can imagine the size of a football field, only the field and no surrounding stadium, the current allowable outdoor rate there would be 643 people. That capacity number would include volunteers, staff, and vendors. Staff from Erie County Department of Health will be sharing additional information about the events and this COVID-19 prevention checklist at 2 upcoming webinar events. Our first will be held with the Erie Regional Chamber and Growth Partnership on March 23rd at 9:30 a.m. And the second will be held with the Nonprofit Partnership on April 7th at 10 o'clock a.m. The checklist is now available on the Erie County PA website under COVID-19 Business Resources. And if you have questions specific to events or want to return a completed checklist, please email it to events@eriecountypa.gov. Thank you.
Thank you, Brianna. Thank you and your team. It was a lot of work to get there, but it's going to be, I think, a great tool for us as the warmer weather happens and events start to occur. And speaking of webinar events, I'd like to invite you to 2 different virtual events coming up shortly here. Tomorrow, first, the Penn State Barron's Public Policy Fund is hosting COVID-19 vaccination in Erie. How's it going? And that will be at 7 p.m. tomorrow night. Our own Melissa Lyon will be part of that panel, as I believe Dr. Nadworny is part of that panel also. So join that discussion with our local experts, and the Zoom information is available at the Erie County Facebook page or at the Penn State Barron Public Policy Fund page. Next, you can join me, Doug Smith from the Erie County Elections Office, Cole Shenley from the Democratic Socialists, and Liz Allen from Erie City Council on Saturday, March 13th, that's this coming Saturday at 10 a.m., for Resilient Communities, Government, and COVID-19. We're going to discuss the government and 2020 elections and how they were affected by COVID-19 pandemic. And the registration is required, and you can find that at events.erielibrary.org. Lots going on. But now we're going to turn to the media for questions, and I want to let the media know that Melissa Lyon, the Director of the Department of Health, is also with us today to answer questions, as well as Brianna Adams and Dr. Nadworny. And today we're going to start with Jet TV.
Good afternoon, Kathy. It's Star. I would like to step back and talk about Albion for a moment. If you can just go ahead and tell me how many tests were administered over the weekend, and what are they doing within that facility to make sure everyone stays safe and gets better?
So my understanding is that over 900 inmates were tested, and a little bit over 200 tested positive. So in terms of their actual mitigation efforts within the facility, that really would be best answered by those who run the Albion Correctional Institution. As we know, that's a state facility, not run by the county. But I think that they're doing everything they can to try to stop the continued spread of that virus within their facility.
Thanks.
Sure. We'll go to David at Erie Times News.
Hi, Kathy. Thank you. I want to follow up on SCI Albion. I think the latest I heard from the Department of Corrections is there are 8 employees who have tested positive. What is the county and the county health department doing in that area to help prevent the spread through employees to the community at large?
So it's important to remember that some of those employees may be Erie County residents and some of them may not be, particularly because of the location of Albion, right on the border of Crawford County and really Ashtabula County. I think you would probably find a lot of employees there who come from regional counties around us. So I'm going to let Melissa Lyons speak to what we would do regarding any specific employees that are Erie County employees. Melissa?
Thank you, County Executive and David, for asking the question. It doesn't change our normal strategy. What happens is when we know that there's a known positive in the NEDS database, we do what's called comprehensive disease investigation. So talking to that individual, determining who their contacts would have been, and reaching out to their contacts and asking them to quarantine. Finding out with the individual that's positive when their isolation period would end, and so they could do the right thing by isolating themselves from others. So it really doesn't change anything there. If the Albion Correction Institution needs any assistance or guidance from us, we're always available for that. And as you can see, we have very good open communication with their management team. So thank you.
Sure. And Melissa, if I can just ask a quick follow-up. Has this led to other cases, many other cases, especially spread, from corrections officers or other staff at the prison?
We would consider the Albion facility an outbreak in Erie County, so that is what happens there. How many have been linked outside of that facility? I don't have those details at my fingertips, and I'm not sure that I would have them entirely. It would depend on the information that is reported by each individual case, and then if their contacts become positive. So we know that there are times when there's incomplete data around that, but I don't have the specifics on that right now, David.
All right, thank you.
I would like to add one thing to this. I think it's important for people to know we have a lot of essential workers who hopefully will soon be able to get their vaccine as we move into hopefully 1B. And corrections officers are one of those essential worker groups that are really in a fairly high-risk situation because they're in a place that's basically congregate living every single day, just as people that would work in a nursing home would be. So we hope that it won't be long before those officers can all get vaccinated and keep themselves and their families safe. Okay, now we'll turn to Talk Erie, to Joel.
Thank you, County Executive. This might be a question for Melissa. And hi, Melissa. Just turning to the vaccine, who is monitoring the actual number of vaccines in the county on a weekly basis? And how would that work when the federal government is sending vaccine directly to pharmacies and federally qualified health centers?
Yeah, so you've brought to the forefront, clearly there is not a repository in Erie County where all of that information is comprehensively collected because the federal government does direct dispensing of vaccine as well as the state doing direct dispensing of vaccine. We've been internally collecting as much data as possible, but I wouldn't be able to tell you that it's complete and comprehensive. So at this point, we're relying on the state's numbers to be the accurate numbers of vaccine in the community.
How confident are you in the state's reporting on their vaccine dashboard? Is that got maybe a 24 to 72 hour lag, do you think?
Yeah, I think that would be what I would have responded, is that there's just a lag in the amount of data that goes out to, like, how much vaccine is being dispensed. I think is pretty accurate. How much vaccine is being administered, like if it was the first dose or second dose, I think there's a lag in that, and that's just because of data entry in particular.
Thanks.
Erie News Now.
Hi, question for Director Lyon. I'd like to move back to SCI Albion for just a moment. To what extent should the average community member be concerned about that? On the one hand, it's 200 people in Erie County who now have coronavirus, which isn't good, but on the flip side, they're not out generally among the general population. How much of a concern is that for the average person here in the county?
Yeah, thanks, Ethan. I think I heard your question clearly enough to be able to answer it. It was, what is the general concern for the population outside of the Albion State Correctional Institute around those COVID numbers? In reality, those that are inmates that are living at the Albion State Correctional Facility are not moving around the community. Where the risk lies is the individuals that work there. They are at potential risk of becoming infected and then going back to their homes or in the community. I do know that the Albion State Correctional Institute management team reported that any employee is welcome to get tested as frequently as they would like. That's my understanding. So I'm really hopeful that the staff are taking advantage of that. So if they are feeling symptomatic or just not feeling well, that they're actually taking precautions and getting their testing so that they can be identified quickly if they become positive. But overall, the concern is mild to low. Thanks.
Thanks.
Okay, now we'll go on to Jet TV Star.
Yes, hello again. I would like to know, in regards to the county, when do we see ourselves going into phase 1B? I know it's a loaded question, but it's kind of going off of the Albion and the correctional officers. When do we see ourselves going into this phase? Is it going to be in a month, 3 months, by the summer? And I know it's dependent on the vaccine supply, but maybe there is some insight on when we could be entering this phase.
I don't believe we have any insight, but we do know that the state will make that call, and they are looking at things from a state perspective. The 1A group, as we know, anyone 65 and up, and those 16 to 64 with medical conditions that would warrant them being able to get the vaccine, includes a lot of people. But I think we're making really good progress on that, and just going from what they're talking about on a national level, that by this summer, probably by late May, pretty much anyone who wants to get a vaccine should be able to get one, according to what the Biden administration is saying. So I hope that that holds true. And I'll see if Melissa Lyon has anything more she wants to add to that.
Unfortunately, I don't have any inside information or any real great projections on when we move into 1B. We're pretty hyper-focused on effectively and efficiently getting the 1As accomplished as fast as we can when vaccine is available. Thank you.
Thanks. We'll go back to David at Erie Times News.
Sure. In the eastern part of the state, one of the Philadelphia health commissioners, Dr. Thomas Farley, was quoted as saying he projects that Philadelphia is going to be able to reach herd immunity by June. I don't know if Dr. Nadworny or Melissa wants to take a crack at that. Is that a reasonable expectation for this part of the state?
Let's ask Dr. Nadworny what he thinks.
David, I think that's highly unlikely for a couple of reasons. Number one, the variants may not be as well protected. We may be not as well protected against the variants with the current vaccines, and we don't know that yet. Number two, the vaccine has not yet been approved for children under the age of 18, who not only are a significant part of the population, but are very likely to get only mildly ill or asymptomatic and help spread it. So I suspect that we will not reach herd immunity, but I guess the question is, what did he mean by herd immunity? Does he mean we aren't going to have a huge surge of 200 cases a day, or does it mean we're not going to have we're not going to have cases at all? So I think part of the problem with herd immunity is that herd immunity just means that you're less likely to have big outbreaks. It doesn't mean that the disease is going to go away. And if Philadelphia reaches herd immunity, that may not give great benefit to people in Bucks County or people in the central part of the state or people in New Jersey or Delaware, because we're all close to each other and people travel. So I think that sounds wonderful, but I suspect it's not realistic.
And just to follow up on that, what he's quoted as saying is that he believes by June that the Philadelphia area is going to reach 70 to 80% immunity. That he's quoted directly as saying it'll be like a more normal summer. You might still have to wear your mask, though.
Well, Part of the problem is that people who've been infected with COVID are often included in that number, but their protection against the variants is much, much less than those people who've been vaccinated. So that's why we're recommending that people who've had COVID get vaccinated. If he's of the opinion that they will have 70 to 80% of their population vaccinated by the summer, then certainly that could very well mean that there would be a lot fewer cases. But I'm not sure what he's going to do about children unless that gets approved for children and we have a major effort between now and June to get them vaccinated. So I think that's optimistic, but I suspect he's using past infection as a measure of immunity. And one of the things that we've seen with the South African strain and the Brazilian strain in particular is that people who've had COVID are getting infected again. So that would be my main concern.
Thank you.
Thank you. I will go back to Joel. Talk, Erie.
Yes, thank you. I have a question for Brianna, and it kind of follows up on David's question here. Since this is a very fluid situation and there is a level of peer pressure that's happening with these states as they start opening up around us, other states want to follow. Are you, is the county able to change its direction as far as percentages and limitations on events, especially outdoor events during the summer after June, in July and August and September and so on, to be able to accommodate, you know, kind of what's happening on the ground as far as governor's mitigation orders?
Yeah, so as soon as any of the governor's mitigation orders would be changed, we would immediately update our forms, update our inspections, and push that information out to people as quickly as we can, the same way that we have been doing for the duration. We have asked the state if we could know what the next level is. Like, are we going from 20% to 30%, or what might the next number be? But we don't have that answer yet, and we certainly don't have a date or know when that's going to happen.
Just a quick follow-up. Do we have any idea in Erie County what percentage of cases, or has there been any outbreaks that have been related to outdoor events, even last year or in the fall?
I don't know if Melissa might have better information on that. I am not in those calls all the time.
I'm happy to provide my response. I would have to, Joel, I would have to actually go back. I feel bad sort of saying, like, my memory is not serving me well. I mean, I'm a year later and I'm like, I can't really recall. I would actually have to have the team go back and relook at all of the outbreaks. And so keep in mind, outbreaks are typically related to facilities. And so when you talk about an outdoor event, it's not necessarily an outbreak, it's a cluster. And so how we define those two things are a little different. So I can ask my team, and if I find something that's worth sharing, I will get that back to you. Is that a deal?
That's great. Thank you so much.
You're welcome.
May I make a comment for Joel?
Yes.
I'm not aware of any super spreader events that have been reported in outdoor gatherings. All the super spreader events that I have read about have been indoors. So I think that the risk of having large outbreaks related to people outdoors is probably low. I'm sure it has happened, but if it's going to happen, it's more likely to happen if there is a large number of people close together outdoors near each other for a long time, which is less likely to happen in the outdoors. But I'm not aware of any major outbreaks that occurred with outdoor events.
Thank you. Thank you, Dr.
Just one more follow-up then. So would you recommend that that the county, in order to give proper notice to these event organizers, to be thinking that, hey, maybe we might get to 40 or 50% capacity by July?
Well, I certainly would like to see, if you're going to have larger gatherings, that people still would be wearing masks. And I think if people are wearing masks, then larger gatherings outdoors probably are still fairly safe. But once people stop wearing masks, as long as there's a lot of cases, like there are now, then the risk is going to be higher. I think it all depends on how many cases we have and how many people are vaccinated and the context of the gathering. It's not quite as simple as it's totally safe, period.
Thank you.
Thank you.
I will put a caveat on that, and that is that the Erie County Department of Health, Erie County government, will stay aligned with the governor's and the Pennsylvania Department of Health's guidance and guidelines, and we will stay aligned with the state and follow their lead on capacity. Okay, we'll go back to Ethan at Erie News Now.
Hi, question for Dr. Nadworny. Doctor, understanding that the risk significantly does drop outdoors, but also looking at fairs and festivals where people sometimes are eating, drinking, doing that sort of thing, how confident are you that we could have fairs and festivals reasonably safely this summer?
Could you just repeat that? I didn't hear all of the question.
Sure. Knowing that at fairs and festivals, yes, they're outside, but people also are often eating and drinking, how confident are you that we could have reasonably safe fairs and festivals this summer?
I think that it depends on two, maybe three major factors. Number one, how many people get vaccinated? Number two, how much COVID is circulating in the community, because the more COVID that's in the community, the much higher the risk is for people gathering outside, especially eating. And I think it also depends on what happens to the variants of concern that we've been seeing, which have been shown to be more contagious as well as causing more severe illness. So I think those are the factors that will determine whether eating outside at fairs will be something that can be done safely. I don't think we can predict it at this point because there's just too many moving parts, especially because the virus is mutating much faster because it's been spreading so widely over the last several months. So vaccination is going to be really, I think, a key to making those events safer.
And Doctor, how encouraged are you? Obviously, the weather is not going to stay like it is today, but as we get toward consistently warm weather, how much does that help stop the spread of the virus?
I think that it clearly makes it less spreadable because more people are outside. But remember, last summer, we had a huge surge in the Southeast and the Southwest because actually probably people were spending more time in air conditioning and they were spending more time together. Spring break affected it. So it's really hard to know what effects the temperature and climate will have. But I think that the more time people spend outdoors and a little bit distanced from each other, just like the guidelines had suggested all along, I think we'll have less spread. But the problem is that people do spend a lot of time indoors with each other because we're social animals. And so it will just depend on what behaviors turn out to be most important.
Thanks.
We'll go back to Jetstar. Do you have a final question?
Yes, I would like to ask about the vaccine sites throughout Erie County. Is there going to be more becoming available? Where are we at in the planning of those, and what are those going to look like in the next few weeks?
Great question. Let me ask Melissa Line to take that.
Yeah, thanks, Star. So the planning continues. Really, it's on a daily basis. We're either meeting with our healthcare partners or working with community partners. The interesting part of this planning is it's sort of happening either with the Erie County Department of Health and the healthcare providers, or with the pharmacies that are getting large shipments of vaccine as well. So with that being said, I'll give you what I know to be true. I'm sitting here today. So the convention center is continuing to have larger clinics, which I'm saying larger, that's around 600. That's twice a week. That's the plan. And then on the 2 days that they're not doing those larger clinics, they're going out into the community, housing authority, high-risk populations, working with agencies that provide services to the underserved populations, those that have difficulty accessing healthcare, transportation, so on and so forth. So we'll have large clinics, and then there are smaller ones. When you're talking about, and that's all for the 1A population. We're not vaccinating anyone outside of 1A. I know the healthcare providers are continuing to do their regular vaccines at their facilities and also continue to plan for larger events, whether that's with the community centers, the Bayfront, looking for other venues. So it's an ongoing planning effort. I think where people will begin to see this wide open opportunity is when vaccine becomes widely available. What we're trying to avoid is scheduling a lot of people to get vaccinated and then having our vaccine orders cut in half. And that's really what's happening right now. We place orders and vaccine is not delivered at the rate that we've ordered it. We're all seeing decreases in our orders. So we're trying to be optimistic in our planning, but cautious that we don't have to reschedule individuals, because that's just disappointing for everyone and a big headache for planning. So I hope that helps. It gives you just an idea of how our day-to-day works around vaccination clinics.
Thanks.
Thank you, Star. Erie Times News. David, do you have a final question?
Well, a quick one, and then I'd like to ask a follow-up. The quick one is, have we had any proof of any of the variant strains in Erie County to date?
I don't believe we have, but I'll have that confirmed by Director Lyon.
No, to my knowledge, we've not had any of the variants confirmed in Erie County.
Okay. And then to follow up, Kathy, you had talked about, I can't remember if it was last week or a couple weeks ago, a question about is Erie County getting its fair share of vaccine. Earlier, almost a week ago, some of the politicians from around Philadelphia complained about their counties not getting a fair share of vaccine. What's the latest? Do you feel, I know Melissa just said we're getting about half of what, she gets about half of what the health department orders. Is Erie County getting a fair share? Is it getting its share as other counties are?
I think when you look at the entire state, there's just not enough vaccine to go around for all of us, and there really isn't yet in the country. So I do believe that the state is trying to be as equitable as possible with the orders that go out, and they have a formula that they use. Then there's also the federal distribution that we've seen some of that come in here in the last week. Both through Walmart and through Giant Eagle. So I think we're getting as much as we can of our fair share, but of course we're always fighting to see if we can get more because the need is so great. It's great everywhere though, and we understand that.
Thank you.
Thanks. Talk Erie. Joel, do you have a final question?
Yes, this one's for you, Kathy. Can you go over again the transportation strategy for those that lack their own vehicles to get to the vaccine locations, especially for those that are living deep in the southern parts of the county? I mean, it's quite a haul to go to the Bayfront from, let's say, Corey or Union City.
So they don't all have to go to the Bayfront. That's important to remember. As Director Lyon just said, we are, with our partners, getting clinics out into the more rural areas. And so that's the first thing. I think people need to look and see if they can't get the vaccine at a clinic near them rather than having to drive, 45, 50 minutes from, for example, Corey into the city of Erie for a vaccine. And there is availability sometimes through the pharmacies in that area, sometimes from where they live, the Erie County Housing Authority, some of the other senior apartments, through agencies that work particularly with the people that are seniors, people that are in the 1A. So that's the first thing I would definitely check. But you can use the lift. You cannot use the lift to go get a COVID-19 test because you might be a person who's contagious. That's probably why you're going to get a test. But you are eligible to use the lift for going to get your vaccine if you are Medicaid eligible. So do check with EMTA, the lift, about that and see if you're eligible. Of course, you have to schedule that ride, but you'll have an appointment and you'll have a time, and hopefully that will work out for you.
Thanks a lot.
Sure. And lastly, Erie News Now. Ethan, do you have a final question?
I do. It's for you. COVID-19 stimulus money perhaps coming to Erie County reasonably soon. Fingers crossed on that. Do you have ballpark estimates on how much, let's say, the county, the city, maybe Mill Creek, some of the bigger areas might get?
We are aware that the county is targeted to receive about $52.7 million. I've heard that the City of Erie could have close to $79 million. I don't have confirmation of that yet, but that's what I've heard. Mill Creek, and I spoke to the Superintendent Morgan out there yesterday, and he was checking to see what they would receive. So any community 50,000 or above, so we only have 2 municipalities in that category, and that would be the City of Erie and Mill Creek. They will get direct funds from the federal government, as will all counties across the nation. And then it's my understanding that more money will be coming to some other entities, such as potentially the transportation authorities, the other municipalities. I saw that there's money out there for agriculture. So there's a number of different buckets of funding, of course, out of that huge package that was just passed by the House a little bit earlier today and will be signed, I'm sure, into law by the President very shortly, if it hasn't already. And we are expected to receive 50% of our funding within 60 days, and then the other 50% about 12 months out from that time. And we have until late 2024 to spend that money. So it's going to be a lot of funding coming into our region, and we want to make sure that collectively we work together to utilize that money in the most effective way to help our community come out stronger out of this pandemic. So there's a lot of conversations already going on even before the bill, which is at the West Erie Plaza, and they're doing a great job in keeping everyone safe with their limited. So, thank you all for again being with us today. I want to end with One Star Business, and that's Icing on the Lake, which is at the West Erie Plaza, and they're doing a great job in keeping everyone safe with their limited capacity being posted on their door. They have an employee station at the front door to help monitor and enforce that store capacity. They have markers installed on the floor to encourage customers to keep their social distance from each other, and install plexiglass at the checkout and along all their counters. And mask wearing is taken very seriously by the staff at Icing on the Lake, and every customer is asked to wear a mask when they are in there. So thank you to that business and to all of our businesses who are working every day to keep you safe, and please support our local businesses as much as you can. If you don't feel comfortable going in, get the curbside pickup, get a takeout, help these businesses stay in business until we can all get back to normal. And so until next week, I ask you all to please do what you can to stop the spread of COVID-19 in our community. Always wear your mask when you're around other people that you don't live with. Please stay as close to home as possible. Please stay safe, and please stay calm. Thank you.